Sleeping sickness, or African trypanosomiasis, is one of Africa's greatest scourges. It has been described as the most neglected of the neglected diseases. In Uganda alone, up to 10 million people are at risk, and over 500,000 are infected every year.
This is where people normally get affected. As you can see, they live in the bushes, and they are the poorest of the poor. The people who normally don't have a political voice.
It is a neglected disease, so it makes the poverty worse. When somebody becomes a victim of the disease, he has to be admitted in a hospital for a minimum of 1 month. During that time, there will be very little going on at home, and therefore the economy will continue to suffer. The socio-economic life of the people will continue to suffer.
The drugs currently used to treat the disease are old and toxic, particularly milazoprol, which has been in use since the 1920s.
We've been left with this awful situation where new drugs just are not coming forward to treat this disease. Resistance has emerged to the older drugs, which have been with us for 50, 60 years or more. We face a potential calamity.
In one of the worst hit areas of Uganda, the Arua district, 30% of those treated are resistant to milazoprol.
The disease is transmitted by the tsetse fly, and from the time the tsetse fly bites the person, it is injecting the parasites into the bloodstream. Now during this time, the patient may not be readily aware that he's carrying this disease, but he has symptoms that can be confused for malaria, for example. Meanwhile, the disease is progressing. Finally, the parasites penetrate the central nervous system, and neurological signs appear, like reversal of sleep patterns. They go into coma and never wake up. It is 100% fatal unless if treated.
The winner of the 2008 Royal Society Pfizer Award is Dr. Enoch Matovu, who is based at Makerere University, Kampala. His main research focus is drug resistance in the trypanosome parasite that causes sleeping sickness.
Enoch's a hugely impressive scientist, came to Europe and really grasped the opportunities he had to learn about modern molecular methodologies, actually translate that information into the development of field-usable tests for drug resistance in trypanosomiasis.
The drugs have been in use for several decades, which provides an opportunity for drug resistance to emerge. And of course, this is what we saw in one focus in Uganda, where we see that parasites mutated. We went ahead to isolate parasites from these patients and to look at the nature of the adenosine transporter.
Enoch demonstrated that the transporter protein plays a key role in the selection of drug resistance in trypanosomes. He bred a generation of parasites that lacked the gene for the transporter protein. This elicited an understanding of how drugs enter the parasite. At a practical level, Enoch's work provides diagnostic tests for drug resistance.
We could clearly see by cloning and sequencing transporters from several isolates, we could associate presence of mutation in this transporter with treatment failure. We got parasites from those patients, cultured them in vitro, and could show that they were not as susceptible to milazoprol. We devised a means of quickly identifying the identity of this gene that we can use in the lab to amplify the gene from parasites isolated from patients, so that we know in advance whether this parasite is likely to respond to milazoprol.
With this test in hand, Enoch and his team are taking samples from all new patients to determine if they are infected by parasites that are resistant to milazoprol. These patients can then be treated with the only alternative drug, eflornithine, at an early stage, saving many lives.
The Pfizer Award has come at the right time. The tests we have developed so far are still confined to the laboratory setting, and we are targeting a disease that is in remote areas. So it's one of our own targets is to develop this further so that we can make it into a test that can be used in those rural areas. And the Pfizer Award will also go a long way in boosting us in this direction.
Even in Africa, there is a capacity to do research. And those who care to stay and can work hard to raise resources for research, they can actually excel.
When we have capacity of scientists who are of African origin, African problems are solved by Africans themselves. They are helping to produce African solutions.
With around 1 billion people living in Africa in the greatest poverty in many instances, it's absolutely essential that African scientists come up with solutions to Africa's problems.
Well, being an African and being in Africa, I know we have lots of problems here, but it's us as African scientists to identify these problems and be able to work on these problems.
I want to see rural Africa a better place to live in. And this has always been my urge to continue working in this disease, going where nobody else wants to go. It's my dream that someday these diseases will no longer be a problem in sub-Saharan Africa.